Good afternoon, Miss Jones. Can you please verify your name and date of birth? Thank you. After our discussion of your symptoms and the new diagnosis of restless leg syndrome, I'm going to be prescribing you a new medication that will treat these symptoms. This medication is called Ropinirole, or better known as Requip. Have you ever heard of this or been prescribed this medication before? No? All right, well, I would like to discuss some important information regarding this new medication. Let's start with how this medication will help with your restless leg syndrome. While the action of this medication in the body is not really understood yet, we do know that the medication does work within the body and help the nerve impulses within the brain and your legs to essentially quiet them down. As you described, a constant feeling of needing to move your legs while trying to go to sleep, and how these symptoms can help make you stay awake, and how you have the need to walk around or continuously move your legs, this medication will help stop those sensations. When you take this medicine at night, be sure to take the medicine 1 to 3 hours before you plan on going to bed. When the medication is taken by mouth, it takes between 1 and 2 hours to fully get in your bloodstream and start working. Once you begin taking the medication, within 2 days, you've got a good buildup in your system and you'll be able to have full effects of this medication. If you stop taking this medication for any reason, please notify me and never start retaking it without notifying me. And you want to make sure that if you miss a dose, you don't double up on your next dose. It can make you very sleepy. Requip can be taken with or without food. Taking Requip with food, however, may decrease the chances of feeling nauseated, as this is one of the side effects. You should not take this medicine with alcohol or any sedating medications such as Benadryl or other sleep aids. The combination of this medicine with alcohol or sedating medications make you much more sleepy and sedated and is not generally healthy. There are known side effects to Requip. If you fall asleep or feel very sleepy while doing normal activities such as driving, or you faint, become dizzy, nauseated, or sweaty, when you stand up from a lying position, let me know right away. Most people who take Requip tolerate it fairly well. The most common reported side effect of Requip for restless leg syndrome are nausea, vomiting, dizziness, and drowsiness or sleepiness. Perfect for trying to go to sleep. You should be careful until you know if Requip will affect your ability to remain alert while doing normal daily activities, and you should watch for the development of significant daytime sleepiness or episodes of falling asleep. It is possible that you could fall asleep while doing these normal activities such as driving your car, doing physical tasks, or using hazardous machinery while taking this medication. Your chances of falling asleep while doing normal activities while taking Requip are greater if you're taking other medications that cause drowsiness. You will want to take this medication when you're going to be home the next day and not plan on any travel or big decisions. When you start taking Requip, you may feel dizzy, nauseated, sweaty, or faint when you first stand from a lying or sitting position. So therefore, I don't want you to stand up quickly after lying down, particularly if you've been sitting or lying down for some time. Take a minute, sit on the edge of the bed or chair before you get up. Some patients taking Requip have also shown urges to behave in a way that's unusual for them. Examples include an unusual urge to gamble or increased sexual urges and or behaviors. If you or your family notice that you are developing any unusual behaviors, make sure to contact me. Hallucinations, which are sounds, visions, or sensations that aren't real, have been reported in patients taking Requip. These are uncommon in patients taking this medication for restless leg syndrome, however. Be sure to tell me if you become pregnant or plan on becoming pregnant, if you're taking any other prescription or over-the-counter medicines that I am unaware of. Some of these medicines may increase your chances of getting side effects while taking Requip. If you start taking other medications while you're taking Requip, this may increase your chances of getting the side effects, and I need to know right away. Do you have any questions for me regarding this medication? No? If you do, contact me immediately. I realize in the past you've stopped taking medications that did have unpleasant side effects. So please notify me right away if you're thinking of stopping this medication. I appreciate your attention. This prescription has been electronically sent to your pharmacy. Have a great day.